Hi, everybody. Please come in video, please.
Good evening, sir.
Good evening, sir.
Yeah,
Good evening,
TOT is in video
everyone.
only, video mode only. Okay, no mute. You have to be in video.
Good evening, sir.
Good evening.
Good evening to everyone.
Yeah, Dr. Tulita, welcome. You are an observer today. Okay.
Thank you. Thank you.
Yes, Tulita. Yeah. Okay. Others also, please come in video. Aditi, we should try maximum to see them in video during. Everyone should be there, not to cheers when you present. So
Yeah,
try
sure.
to be in video.
Hi, everyone. Nice to see you all again.
Good evening, ma'am.
Hi.
Good evening,
Yeah,
ma'am.
Francis is
Good
there.
evening. Good
Francis
evening,
is there.
everyone.
Good evening, ma'am.
Yeah.
Good evening.
all-
sir.
Yeah, good evening,
Good evening, all.
Francis. Oh, Suleha madam and all. Nice to see you all. Chandra Velasamy, yes, yes. Okay, okay. Leslie, Ismail. Yeah, Clara, good. Shalini, fine. Okay, so we begin. Okay, so we start with the opening address. Small, be in the, of course, in an informal setup. Okay, don't worry. There's nothing very complicated for you. Okay, Aditi, shall I begin?
Yeah, of course.
Okay, my dear Ecolink family members, I would actually like to address you more as our collaborators and educators and trainers, not as participants this time. Till now, we were calling you participants, but you are much above that now. So let's feel better. All of you have actually completed your UTC curriculum from 1 to 8. And several of you have even passed your ICAP exam and got credential. Some of you have attended other curriculums like what Francis was offering, the child curriculum. Some of you attended WISE curriculum from Colombo Plan. Some of you have, like I myself have actually forced you into prevention curriculum, universal prevention curriculum on various tracks with the Colombo Plan. Some of you have attended even the URC, universal recovery curriculum, like that. So you are not only UTC people here, you have already got into other things also. And when I look at you like Devika and Dr. Nasri, are you here? Some of you have done extremely well after your UTC training back in your countries, in your communities, and was an inspiration for all of us all the time. When you put up your things, great things, whenever you are doing things like that. And as you all know, working with substance use disorder is not a joke. It is sometimes very rewarding, sometimes very frustrating, and everything may not go all the time well as we are dealing with a brain disease. It's something, a disease which affects our brain and central nervous system. So we have to expect ups and downs in our mission. But you may have noticed, some of us, at least me, this is my 31st or 32nd year in media. Look at Aditi. Aditi, I'm sure it's more than 25 years. Maybe if I say 30, and she will be upset because her age will also become more. So maybe 25 plus. And Francis is also definitely, I think, almost reaching 30 years of experience. Thiru ma'am, she is also more than 30. So none of them have started working as global trainers. They all have started as clinicians, like therapists. In their own field, they have shown that commitment in this field. And then they started doing small trainings in the colleges and schools and communities. Then they became national trainers, and then they became global trainers. So now when we organized this program, some of the participants were asking whether this training will definitely make us global trainers. I said no to some of them. I mean, I said no and yes also. Some of them took that no very, very seriously. So normally to become a global trainer, you need to attend a global TRO, TOT, organized by Colombo Plan or UNODC. But normally they will select people for that from national trainers. So this particular TOT is aimed at promoting national trainers or trainers within your own countries, like, no? And from there only, definitely, I'm sure that whenever there is an opportunity, they used to also request me to refer some people. So you would all be into the track of becoming global trainers also. There's no doubt about that. So believe you are in a right platform with a right sort of a commitment and goals. Set your goals. We are going to really, fly. Of course, when we look at our journey, we had failures, definitely. So it's not that easy. Like all the time, you may have noticed, like, some of our projects we wanted to engage you, but we failed actually. We have been training people, but we have not done so much actually to engage you into the field, into your practical field or into us trainer. This may be the first time we are thinking about a TOT. So let's appreciate each other. That even if we have failed, we are using a stepping stone, to do something better to involve you. Some of the areas where we couldn't grow as much as we expect was ARCO. It was a very ambitious project of ours, but we are not keeping ARCO out. This TOT is also aimed at promoting our ARCO. ARCO is Addiction Recovery Coach Online. So in one way or other, we want every one of you who are in this platform to be engaged into something which is really going to give a path, a track record for you to grow. Yes, so you have a lot of scope. So believe in that. None of the global trainers, like whom you see here with us in our team, they have not just born as global trainers. So all of you have a potential to become that. But global or local, you're a trainer. That's more important. Take it in that spirit. So try to reach out to others with the expertise which you have received from UTC, because you are going to train one of the best universal treatment curriculum, so which has been approved in many countries. So that's the stuff which you have in hand. And I do not want any of you to go without becoming a trainer. All of you have the potential. So all the best for all of you. Let's aim big. And we welcome all of you once again to this TOT on behalf of Ecolink Institute. Now, clap, 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 clap. Okay, now over to Aditi to welcome you.
Oh my God. Okay, thank you. Thank you, Thomas. Thank you, Ecolink and the entire team to organize this program. It's not easy organizing programs, so I really salute them for continuously going on and making an effort to contact people and organize things. I'm so grateful to all of you who have taken time out of your very busy schedules, because I know all of you work and to attend these sessions. So thank you so much. I know all of us here, because I think I know everybody. I've seen you all not once, twice, but I think number of times. And I've even probably worked with you all, some of them. Yes, Nima and Liba are there. So I'm so grateful that I'm with a team of trainers who have such a strong base. And most of us are good trainers. And so whatever I'm going to share today is not something out of the blue. Maybe it is something many of you may have known about it, already know about it, but treat this as a refresher course to the next stepping stone. Gather, maybe there's something that you will learn today, maybe one liner or something. So I'm going to share whatever I went through as a trainer in this last 25 years of my experience. I'm going to talk about online training whenever my turn comes, and Francis is going to share of offline training. So we have taken those, that division. Of course, basic training remains as training. So basically, I want you all to share your valuable experience as a trainer as we go through the presentation, because it's going to be an interactive session. There are going to be tiny exercises that you may have to answer, brainstorm, talk about it, talk about your own experience as a trainer. And because each one of you bring in a very valuable experience to this floor, and it is very important for us to learn from that and then move ahead as a trainer. So let's see how to become not only a trainer or a good trainer, an inspiring trainer. So when we train, we want to inspire the participants to know more about the subject, to learn more, to actually even search more about it, and then to become a trainer in that. So it's not just being a trainer, you have to achieve that stage of being an inspiring trainer, and let's put in all our valuable experiences to become one. So thank you so much for having Thomas, having chosen me as one of the, I would say, facilitators to this whole group of great trainers. I'm a little nervous today because they are not participants anymore. They come with rich experience, I know. And so let's all take this forward and to a great beginning. Thank you.
Thank you. Thank you. Thank you. Okay, now over to Francis. And Francis, you are muted, I think. Yeah, unmute.
Yeah. Friends, it's indeed a very, very welcoming moment. It's a wonderful occasion too. It may be the first time, maybe in the world, that we are having a TOT of participants who have undergone online UTC training. I must appreciate Dr. Thomas, my dear friend, with whom I had a lot of quarrels and a lot of fun. We were together in Colombo Plan for some time. So it's really an auspicious day. Coming to the training that we are going to attend today and the coming days, let me tell that it's not something that new we are going to teach you. I always understand and wish that you are all better trainers than I do in many ways. So congratulations to all of you who have been part of this. And I have a practical suggestion to all of you. Once you finish all these training, please give your addresses, email ID, phone numbers to Thomas. Maybe he's already having. Or else you mail to me. I would give your names to the NIST, National Institute of Social Defense, because I am much closer to the Deputy Director, Dr. Manoj ToT. Because I personally have been taking a lot of sessions, both in English and Hindi. Of course, my Hindi is not that good. Even still, I'm a popular guy who takes sessions in Hindi. So many of you speak better Hindi than I do. So maybe the National Institute of Social Defense might call you as resource persons. So that's my suggestion. Either you give the addresses and phone numbers to Thomas, or you directly message to me so that I can contact and tell Manoj, these are a bunch of resource persons whom we can utilize in the future. Because every year in the beginning, in the month of April, this Mr. Dr. Manoj used to ask me names of resource persons. Of course, we have given our names and all those things, including Aditi ma'am, Thiru, Susmita, Thomas, etc. But next, after you finish this, we will also give you our names as a recommended suggestion for taking sessions. What I would say, if they call you, invite you to do a session, please do it. That's your first chance to do something great. And that's how you become trainers. I remember way back in 2010, this NIST invited me as a resource person in New Delhi. And they did offer me just 3,000 rupees per day. 3,000 rupees per day. But they didn't offer me any flight charges, anything else. But still I went there. But I was happy and lucky to have getting the honorarium in a higher rate. And also I got the flight charges, etc. But when they invited me, they just said they offered only the, just 3,000 rupees. So if I thought that 3,000 rupees is a very little thing, very, very small thing, and if I had not gone, I would have never had a better relationship with an IST. So I would always suggest, and finally I would tell you, relationship is more important than your talents. Interpersonal relationships are much, much, much important. Whether you are a talented trainer, whether you are a trainer with a lot of knowledge, what matters is, after all, your interrelationship skills and communication skills. Thank you all. Thank you, Dr. Thomas, my dear friend. And I'm very happy with my Aditi ji, because we both of us are doing very happy to be a co-trainer with Aditi ma'am, and with all of you, because you are all trainers. Thank you very much. Thank you very much.
Thank you, Francis and Aditi ma'am, definitely, so it has already set a mood for the training. Now, the next agenda is actually get to know each other, but I think all of us know each other. May not be all of us, but you are from different batches. That's the problem. Some of you are from the batch 1, batch 2, some are from batch 9 also here. So let's get to know each other a little bit, your name and what you are doing after your UTC, how you have integrated your UTC training into your practice, and your expectations of this training. This many things, if we can speak, great. Aditi, anything else?
No,
So,
that's
yeah, that's it.
good enough.
But we don't have much time, so anybody can start speaking from any corner, no problem.
Actually, I didn't realize they are from different batches. I thought they are from one batch,
different batches,
because they look so familiar.
But you are there in all the batches. That's
why, maybe. Yeah.
Okay.
No, all of them are familiar to me.
All are familiar, definitely. They are all our alumni.
Okay, I think Georgish is ready to go.
Georgish is from the last batch, 9, I think.
Yeah, let him go first.
I am 8th batch.
8th batch, okay. Go ahead.
So, good evening to one and all. Respectfully, Dr. Thomas and Aditi ma'am and Francis sir, and all other my colleagues, I can say my classmates, many of them were there. All are familiar faces to me. And I am Father George Sprito from Jaipur, Rajasthan. Originally, I am from Tamil Nadu, Kanyakumari. I have been in Rajasthan for the last 20 years. I have our diocese over here. I have been serving as a director and the administrator of the De-Addiction Rehabilitation Center run by our own institution. And I come in contact with Dr. Thomas just a year ago. And I did my UTC 128, then UTC 14, and child also from Dial View. Recently, I have completed. It is a wonderful opportunity for me to be part of this TOT training. Why I chosen this being keeping oneself updated and enhance our own knowledge in the field of de-addiction and rehabilitation program. I may not be a better trainer, but surely I can be a better learner. So I can learn from each one of you better way possible. I can say that my credit to what I have, Dr. Thomas was telling, Dr. Thomas or Francis, somebody was telling, after finishing the course, you do something, you don't. What I after the UTC, I worked on the licensing of our center from the government of Rajasthan. So I had worked for last, after finishing my UTC 128 and 14, I worked for 4 months or fulfilling the file document work. I have submitted in the government and my file was being accepted. The order has come from the government. They will come for the inspection. So this are I learned from, it was a credit from the UTC that gave me the courage and confidence to go on. It was the month of March, the order came from government that every DAD center should have the license. But
that's very nice.
I am working on it. Yeah. Hopefully, I will get to sooner or very soon the license, because the election, all those things are there. But I got the letter from the government giving dated 6th of October that they will be coming for the inspection. So this credit goes to the Ecolink and Dial View, all my teachers like Aditi ma'am and Thomas sir and the Francis sir. So this is what I learned. So when we keep on, you may not be a better professor or a teacher or a trainer, but you can be a better learner. So learning can help you to do well in your job. And I also have changed my viewpoint regarding the de-addiction and rehabilitation program after attending the course only. So I am doing better approach towards my patient, those who are here. Hopefully, it is in a journey. Recovery is only a journey. So we can be in a better, maybe a watchman or guide in the journey of. So thanks a lot.
Thank you, Jagdish. Thank you. Okay, so next one. Fathers always speak more. Okay, it doesn't mean everybody have to speak more. You can also speak less. Okay, Abhijit Sinha.
Yes, yes. Good evening, everyone. Myself Abhijit Sinha. I'm from the 8th batch, and I can see three or four: Sunisa, Ismail, and Georges. They are my batchmates, and rest of us from a different batch, I guess. Uh, so it was a very. I won't say good, more than good or great experience in UTC course, and I was working in treatment rehabilitation center as a psychoeducator for more than 6 years. Now it's going on to 7 years. But I didn't have any like formal education on these things. Uh, I just working on my practical experience on my own recovery and the learning I got from my counselors, etc. But after taking the UTC course, there were a urge to learn something real. So this course forced me to do many more things. Like I have enrolled in a master's in psychology. My first years also is almost completed. In December, I have the first year final term exams, and I have done some certificate courses in between also. And I also applied for the child course also, but I don't know why they did not get me the link. Someone called from the Dell Institute. We had a conversation, but after that, I don't know when it got started, when it got completed. I don't know. But however, the UTC course and the materials and the learnings helped me immensely in my practical work. Because like when I previously I took psychoeducation classes, the knowledge I have gathered from here, it's become far easier to deliver the message to the patients, and they are understanding it in a easy way. So this learning is very useful. So when I got this opportunity for the TOT, I didn't thought for a second. I immediately responded that I am into it. So I'm into it. I'm looking forward for another experience, excellent learning experience. So thank you all.
Thank you, Abhijit. Yeah. Okay, Dr. Manish.
Yeah. Good evening, everyone. Good evening, Thomas, Aditi, madam, and Francis, sir. I am Dr. Manish Shukla from Mumbai, and it is really a big privilege to be here. I have completed my basic UTC and ICAP from Ecolink, and I'm running a rehabilitation center in Mumbai from last 15 years. And the one of the benefits what I have gained from UTC to be how to be on a ethical front and how to develop a professionalism attitude towards our work and towards our field. And with all these qualities, I have gained a license from SFHA, State Mental Health Authority, for my rehabilitation center. And apart from this, I have completed my master's in clinical psychology, and even I am learning and enrolling in various courses. One of these courses is from State Mental Health, which executes to how to be more therapeutic towards mental health patients. And I have also completed my tobacco cessation program from NIMHANS. And one of the achievements what I have received is we are working with the Chief Minister of Maharashtra towards the policy renovation in this field. So all this, I'll say all this innovation and executions have been derived from doing the courses from Ecolink. Even I have also done URC LEs from Colombo plant.
Good.
And
That's good.
enrolling in TOT is my main objective is to be a good trainer which will present the module in a very limited time. Because one of the things what we face while presentation is we take a longer time in delivering the presentation. But I think working with these experts, Thomas sir, Aditi madam and Francis sir, will help us to get the time limit, the delivery in the time limit. We will be more accurate towards that. Thank you very much, sir.
Thank you, Dr. Manish. Thank you. John Smith, our friend.
Yes, good evening, everybody. Really an amazing privilege for me to be part of this group. I was part of the second batch, and I did my ICAP, and I also did the TOT for Recovery Allies. And really, really awesome to see some familiar faces and some new faces. And this training has just opened up so many doors for me. I'm originally from South Africa, currently living in Thailand. I've been here for 4 years. I work as a senior therapist at an international treatment center called the Dawn Wellness Center and Rehab in Chiang Mai, northern Thailand, where I'm also the departmental training facilitator, the aftercare coordinator, and the step time coordinator. So really, really awesome to be here. Thank you very much for the opportunity, Dr. Thomas.
Thank you. Thank you, John. Yeah, John is also a member of our International Consultative Committee, so very actively involving in our programs. So yeah. Okay. Next. Oh, Shalini, ready. Okay. Anybody else? Abhijit's hand is up, but I think keep it down. Let others speak. Yes, Shalini. Yeah.
Good evening, everyone. I'm Shalini. My full name is Shalini Sagar, and I'm from New Delhi, India. I run my organization, which is a 10-year-old organization actively working in substance use prevention for last 7 years. The name of the organization is Social Development Foundation. By education, I'm a professional social worker and a public health consultant. I have completed multiple levels. I don't exactly remember what all levels, but I've completed multiple levels of UTC, UPC, child curriculum, and currently pursuing WISE program. And Aditi ma'am is one of our esteemed faculty there as well. My organization is empaneled with NISD, Ministry of Social Justice and Empowerment, Ministry of Health, Government of India, Subharti University, Amity University, Delhi University, and multiple schools in Delhi. So how Ecolink has changed me is earlier we used to do programs and we had been conducting multiple programs in a year. But now when I go or when I walk in any of the institution, I'm more confident. I feel that I'm professionally trained to conduct the workshop, though I'm a professional social worker. But what learning I have gained from Ecolink makes me more stronger and more experienced trainer, though not qualified by Ecolink. But when I walk in, I'm more confident. That's what I want to say. Recently, within a time frame of last 2 years, we have been able to reach to around 700 schools for our sensitization program. Currently, today only, I have signed a MOU with Pepsi India for doing awareness program in 1,000 schools. So Pepsi is supporting us through their CSR program. to do the sensitization program in 1,000 schools all over India. We have to choose the area of work. So my main interest is women and children. I'm looking forward to learn a lot and many other skills from all of you. Thank you, Ecolink, for giving me this opportunity.
Thank you, Shalini. So nice. Great. Okay. So next person, Jimin, get up. Unmute and speak. Yes, yes.
Thank you so kindly, Dr. Thomas. My name is Kemini G. Gete. I am a pastor. I am also a clinical psychologist. I run a private practice in clinical psychology in my country. And I also assist the only referral mental health hospital in my country is called ES Grant. I sit on the technical coordinating committee for mental health in my country. And also I'm currently a member of the TWG, that is a technical working group that is developing the mental health policy of the country or reviewing it. I mostly get SUD cases in the center where I practice and also the government referral hospital. And so I thought to sharpen my skills in working with people with SUD, with substance use disorder. And I joined Ecolink when I, got to know about them online, and it's been more than a year now. I did bulk of the courses, and they've really enhanced my service provision and even educating the community and my own church about substance use disorders. So I'm so happy to join this team again of rich resource persons and colleagues who are also very experienced to learn more so that I'll be more resourceful in my service to my country and people within my reach. Thank you.
Thank you, Jamin. Thank you so much. Yes. Okay, Ismail Lawal.
Yes, thank you very much.
No video, Ismail?
Can you hear me? Okay.
Can you come in video also? Yes.
All right.
Yes. Good.
Okay.
Good, yeah.
Good to see you again, and good to see all my colleagues from the previous training. I'm happy to see Aviji and a lot of others. So I'm Lawal Ismail from the medical doctor from Nigeria. I've been working in the area of addiction and psychosocial counseling with a lot of experience working with HIV patients and also supporting a lot of military facilities in Nigeria. I have been also involved in also supporting the children, especially adolescents who are HIV positive, who are having some little issue around mental and also drug addiction. And that's what I've also been supporting. And over the time after the training, I've also been part of the Nigerian technical working group on methadone scale up in Nigeria and also addiction management, which is being supported by the UNODC in the country. And we are trying to see how this can be supported, and also we can manage a lot of patients with addiction. And we are working closely with sites like a Federal Neuropsychiatry Hospital in Lagos, and I also support the military facility in Lagos, in Abuja, and almost about 7 states in the country. I'm very happy to be in this course because when I saw it, I felt this will also had a lot of support to me and be able to also build my capacity, because I also conduct training on addiction, HIV counseling, and also support for a lot of people who are positive. So this will also be a way of building my capacity and supporting my career, and be able to add more in the support of people who are having issues with psychosocial problem in the country. So thank you very much, Dr. Thomas, and a lot of other facilitators for giving me the opportunity. Thank you all.
Thank you, Ismail. Thanks a lot. Yeah. Okay, next one. No hands are raised. What is this? That to jump, no? Yes. Suman, yes, Suman. We have less time. Everybody have to speak also. So fast. Unmute, Suman. in online, that is the first thing.
Okay. I'm Suman. I'm from Mangalore, Karnataka. I'm working as a counselor in KSEC, the Medical Academy. And within another 10 days, I'll be joining a different institution. It's the Tunga's Institute of Mental Health, which will be having only de-addiction and psychiatry. And I'll be heading the de-addiction department, which is 350 bedded de-addiction center, actually.
350 bedded?
Yes, sir.
Oh my God.
It includes rehab also. It's include rehab also. Yeah. So I'm from my UTC batch 7, and after attending this course, I can say that whenever I sit with the patient, I always think what better I can do for this patient. And my nature of working has changed. Definitely, the way I think, the way I do my work is like a way of working has changed, way of thinking has changed. And I think I credit goes to Ecolink for giving me an opportunity to join with you and learn more things. And I have an opportunity to join this course. The main purpose of joining this course is I will be having 15 to 20 social workers under me who will be exclusively working for de-addiction. So I have the responsibility of training them mostly. So I might take Thomas's help in training them. So that is the main purpose of first me. I want to learn how to train them. So thank you for the opportunity, sir.
Thank you, Suman. Thank you. And all the best for your new assignment.
Thank you, sir.
Thank you. Yeah. Yes, Ramya.
Good evening, Thomas, sir. Good evening, Aditi, ma'am, and good evening, Francis, sir. I'm Ramya. I just completed my UTC 1 to 8 curriculum. I'm from the 9th batch. I have done my master's in clinical psychology, and I'm from Pune. But then the experience in this field as working professional, I haven't had much, even though it was very brief for 2 years. Then I was on a sabbatical. So thereafter, so I've been doing courses, and I was sort of suggested about this one UTC program by one of my mom's dear friend. And today I can say that, I took a very wise decision by enrolling and doing the course, completing the 8 curriculums, and also being a part of the training program, with all the esteemed people out here who have got so much of their experience behind them. And I'm looking forward to learn new things as I delve into this field, and putting my whatever I've learned so far into practice. So thank you so much.
Thank you. Thank you, Ramya.
Yeah.
Good. Okay. Oh, now we have Luella from Canada. Canada, no? Okay.
Yeah. So,
Okay.
good evening, Dr. Thomas, Aditi, and Mr. Francis. Thank you so much for including me in this program. I feel very inadequate and small when I listen to all the accomplishments and achievements of everybody. I've been in Canada now for the last 7 months. I've just got my work permit, so I'm looking for a job, and I'm looking in the area of addiction and rehab. Things are very different over here. Unfortunately, they don't recognize many of the courses and qualifications that we do in India. So I'm a master in counseling psychology, and I've been practicing as a counseling psychologist. I have my own private practice called Spring of Wellbeing, but I haven't been able to do much here ever since I've come. So I'm really looking forward to the course, because I think it'll really help me to refresh my knowledge, and also I'm sure it'll help me in, getting a job probably in this area, and also looking forward to helping out with Ecolink in the training in the future. So yeah, thank you.
Okay. Thank you, Luella. Okay. Yes, who is next? Dr. Mohammed Nasri
Hi, good evening to
from
Thomas.
Malaysia.
Yeah, hi.
We
I'm
cannot hear
Nazri
you.
from.
Yes.
Can right.
Yeah, I think so.
Good.
We can hear.
Okay. Good evening, everyone. Dr. Thomas, Aditiman, Francis, sir. I'm Nazri from Malaysia. It belongs to third batch. I think Jyoti is here. It is my batch. I am a family physician and working in the government hospital university, as well as I also receive additional referral from the government clinic. So in terms of scope of job, is I much involved in community addiction services, and then also been part of the team for the bed outpatient counseling for addiction issues, addiction problem. Actually, I'm involved in addiction field since 2011, but I remain inactive, passive, because I probably involved the entire time with the community in terms of providing education and all that until UTC changed me back in the third batch. So I start to slowly practicing the patient. So that made me a perfect, I mean, nearly perfect in terms of now seeing the patient in the field rather than just focus on the screening and brief intervention. So I should thank all my teachers and then Ecolink to accept me as for TOT trainer. Hopefully that this is my ambition actually to be probably representing Malaysia of UTs of Ecolink so that I can train with my other colleagues that train by Ecolink to train more colleagues from Malaysia. Thank you.
Thank you, Dr. Nasri. Thanks. You have done a lots of work. We are very proud of you, Dr. Nasri. Okay, yeah, Nitin and Devika. So Devika, you can speak.
Good evening, all. Hi, ma'am, Aditi, ma'am, Francis, sir, Thomas, sir. So I'm in this field of addiction since 23 years. I've completed 23 years in this month. And yeah, I'm ICAP certified. And I also have done my global master training drug demand reduction UNODC in Abu Dhabi 2022. I have done UPC 1236 and I think I have enrolled in WISE and advanced UTC courses. I've done, I think, motivational, and I have done child curriculum. Regarding my professional work, I'm associated with the government sector, commissionerates. It's been almost like since 20 years I'm associated with them, doing projects with them and prevention aspects in substance use field. So we are doing a project called Safety School Clubs. In that, one of the education vertical is about drug abuse prevention in schools. So almost like we have covered nearly 80 schools, I guess. It's a continuation of the project. And Sunisha is here. So there is one more project we are doing, Mission Parivartana. So I was trainer for community educators. So they have pick few community educators in order to do this program. This project is by the MS JE NIST. I'm also resource person for Nashamukht Bharat campaign, and I also train excise department constables on psychosocial aspects. And I'm what else? Yeah, I'm also committee. Sorry. Committee member for this NALSA. This is something called every state has state legal service authority. They're one of the objective guidelines given by Supreme Court is about substance use prevention out of 7 projects. So I'm a committee member in it. So through them also legal service authority, we are doing a lot of programs in colleges, educational institutions. That's it.
Thank you.
That's not it. I think you just name it and Devika's there. And she gives us the latest know-how what's happening in India. So I think I always refer to her and ask her, is this right or something?
Yeah.
Good,
thank you,
Devika. You said 23 years of experience, but you don't look more than 23 years old also.
Oh, that's a compliment.
Anyway, good, nice. Okay, now over to Nitin. Nitin? Yeah, Nitin. Yes.
Yes, hi everybody. Yeah, I'm Nitin De Silva. So I'm from the first batch of UTC training, which was done by Ecolink. And yeah, so I have been in this field for last just 5 years, so I can say. And I started my career into teaching. And after UTC, I have done UPC, a prevention curriculum. So since then, I'm more into prevention than into, what do you call, uh, in the field. So I have been doing webinars and seminars related to substance use prevention. Yeah, so right now I'm working as a corporate psychologist in Mumbai. So that's about me.
Thank you. Thank you, Nitin. So all the best. So you will become a good trainer also. Okay, Sunisha. Sunisha, don't tell you have 25 years of experience, huh?
No, I don't.
Okay.
Good evening, everybody. Good evening, Dr. Thomas, Aditi ma'am, Francis sir. So nice to see all of you after so long. So my name is Sunisha and I am a UTC 8 participant. It's very nice to see some familiar faces from my batch. So as Devika ma'am had already shared, I was part of a project called as the School Safety Club, where we have touched more than 80 plus schools. And I was part of the anti-drug abuse vertical, where we go to various educational institutions and talk about and create awareness and create conversations about drug abuse prevention, sensitization, etc. Currently, now I'm working as a community educator with the mission Parivartana. That is a project that is started by the PWD department and the Telangana State Anti-Narcotic Bureau. And under that project, we have successfully done a lot of prevention programs in 35 schools, and we are continuing so. Thank you so much.
Good. Thank you, Sunisha. Thank you. Okay, Shital, yes.
Good evening, everyone. Thank you, Thomas sir, for arranging this. Aditi ma'am, Thomas sir, good evening. My name is Sheetal Vidkar. I'm a trained clinical psychologist. I just submitted my PhD in prevention of addiction work. I'm working in the field of de-addiction and counseling since 2009. It's been more than 15 years. It's great to learn from Ecolink every time and implement the new things. My work started with absolute de-addiction in rehabilitation centers, but when I shifted to Mumbai, I get a better platform. Now I'm associated with the organization Global Hospital for Liver Transplant Patients, basically. I'm also closely giving de-addiction services and handling the clients from cancer and diabetes distress management also. There's a huge scope of managing different clients from who are dealing with different diseases like cancer, diabetes, and liver transplant, and so on. When it comes to addiction, there is a need to total abstinence to manage those disorders. So I'm actually using the piece of motivational interviewing in all these new two sectors, along with the understanding of social therapeutic work. I'm also associated with the narcotic department here, and we are running the Drug-Free Mumbai campaign. So far, we have done 80 plus colleges and sensitizations program with them. I started my career as a RRTC trainer from Muktangan, Pune. And thus I was able to see at least 5 different states, and I used to work as a trainer at that point of time. Eventually, I started more and more close work with clients. I also finished my child curriculum last time and UTC training for 1st to 5. Thank you so much.
Thank you. Yeah. Okay. Who are the anybody else? Yes. We have not much time, but definitely all can speak little. Okay. Who is next? Clara. Yes, Clara.
Yeah, my name is Clara Dikuna. I'm from Mangalore, Karnataka. I did my UTC in person in a mosque where Francis sir and Aditi ma'am and Thiru ma'am and all of and Dr. Nirola and all were there. It was a great experience in person, and I did my ICAP there, finished first ICAP 1. and I was sent there through Dr. Thomas. And it was like, I know Dr. Thomas from last 25 years. I started in 98 to work with the people with the SUD. And I was sent to trainings to TTK first, 99. Then I think several trainings. Even in Mangalore, we had few trainings. And I have a place for women with the SUD, and also for men. I started an NGO 12 years back, and I'm working in this field. Like before I was working in Link, and after that I started working now as a started a organization, and mostly as a counselor. I'm not much going out, training our staff. Thomas is also part of that. And now last month I started also going out because the drug problem is so much in Mangalore, our area, and we had training and we are doing that work. And I'm so grateful to be part of this program. I also did small trainings here, UTC, in Ecolink, also beginning small trainings. And yeah, that's, I think, all I want to say. I talk less. I think I spoke little more today. Thank you.
Thank you. Thank you, Clara. Thank you. Okay, so who else is there who have not spoken? Yes, Dr. Sulekha Venugopal. Yes.
Hello, good evening, everybody. Nice to see all familiar faces. All respects to the gurus, that is Aditi ma'am, Francis sir, and Thomas sir. I had the rare privilege of being in two batches, that is the first and the second. So a lot of familiar faces are there, and happy to see Ramya also, one person whom I could introduce to this, and I'm sure she is really being benefited, as all of us are. I'm a counseling psychologist by profession. Did my UTC as well as UPC from Ecolink, Colombo Plan, and I'm living in a remote village. I'm able to guide some people, and especially during the counseling, a lot of children, and also some people who are addicted, and in alcoholism mainly is the problem here in this village. And I also go to a number of schools, and as a part of the Vimukti by Kerala government. So I just address the people, children who are there in the Vimukti club. That's all for what I have to say. Thank you so much.
Thank you. Thank you, Sulekha ma'am. Yes. Okay. So is there anybody else? Chandra, you spoke.
Doctor, I'm Denzel here.
Yeah, Denzel. Yes, Denzel.
Yeah, happy evening to everybody. I'm Denzel here. I'm basically a psychologist. So I done my BSc, MSc, and PhD in psychology. I work in two areas, and I work in Institute of Stress Management Happiness Clinic. My areas are two: teenage challenges, where we handle sex education, and SAD, smoking, alcohol, and drugs. And we work in de-addiction centers in prison. And second area of my work is I work for couples. We do premarital and couple counseling. And in this teenage challenges, I was really attracted by this UTC program. And I did 8 modules of UTC. It was excellent and had a very good learning. And my whole quality of my service has improved. And I attempted ICAP 2 also. And I am happy to enroll in TOT. And I am very sure that this is also going to add value to my service and to my knowledge. I wish you all the best. I thank Dr. Thomas for adding me to this group, and also Aditi madam and Francis sir. And I wish a team very happy learning. I'm sure this will be useful to everybody. Thank you, all the best. Have a good day. Take care.
Thank you, Dr. Denzel. Thank you so much. Yes, Chandra Velasamy from Malaysia.
A very good evening to all, especially my teachers and my colleagues. I'm basically from batch 5, situated in Kuala Lumpur, Malaysia. For me, I basically work as a school counselor, but promoted to district education department. I mostly cater for prevention for adolescents, and I involved in the national level for education department to form modules to formulate intervention classes for teachers and counselors in entire Malaysia. For me specifically, I entered ICAP as an accident. So basically, I were never exposed to addiction field until I were in my 10th service year in Malaysia when I came across one case regarding for drug abuse and so on. So it attracted me. Then do a little bit of research. Then I did my master's in substance abuse counseling, and currently I'm still in passion to help the community, especially the parents and the children in Kuala Lumpur setting, for the mostly underprivileged community and so on. So basically that is my work, and it's nice to know everyone here, and hope to learn a lot about drug abuse and how to be a good presenter and trainer in the future. That's
Thank
all from
you.
me.
Thank you, Chandra. Thanks a lot. Yes. Okay. So we have one or two more people. There is one Jyoti Bharadwaj from Himachal Pradesh, and who else is there? Oh, Roni is there.
Yeah.
Liba is there. Oh my God,
Nima is there, Liba is there,
Okay.
Chatura
Everybody,
is there.
one minute. It's okay, no, ma'am. It's okay, no.
Yeah, it's okay. Just
Yeah,
let
okay.
them be. Yeah.
Yes,
No.
let
Hi.
Hi,
Okay,
Nima.
hi.
Hi, everybody. Hi, ma'am. Hi, sir. Hi, Francis, sir. So, always when it's come to Ecolink, I feel like family. So everybody is familiar faces. Like here is a place where we can learn openly and without any fear. We can learn a lot. So I have experience of 14 years in the de-addiction field. Now I'm currently placed with MRF Tires. It's a tire factory where I'm working there as a family welfare coordinator. I work more on prevention, and I'm referring clients to de-addiction center, and I do follow-up counseling with them. And I have created a recovery support group within the factory, and just adding people on that and helping people whoever have this issue within the factory. Thank you.
Very nice, Nima. Good. Thank you so much. Yes. Okay. So, Liba.
Hi, everyone. Hi, ma'am. Hi, Francis sir. Hi, Thomas sir.
From
Hi.
Daleview. Yes,
Yeah,
speak.
this is Liba. I'm from, Kerala, currently working as a clinical supervisor at Daleview. Daleview is an addiction treatment unit and also an education provider of Colombo Plan DAP. And we are also offering offline UTC training in regional language Malayalam. And our chief trainer is Francis only. And I'm also taking few sessions in that. And I'm from the first batch of Ecolink, and I have cleared level 2. I kept level 2, and I have attended few prevention 1, 2, UTC 1, 2, 3, and 6, and wise to UT and child curriculum. I really grateful to Ecolink that I have got all the reference through Ecolink only. So I'm always grateful for that. And thank you. That's all.
Thank you. Okay. Yeah. Hey, Ronnie. Yes.
Okay, good evening, everyone. It's a pleasure reconnecting with all of you all, the Ecolink family once again. I have been an integral part of Ecolink from day one, and I really relish every moment I have given on continuing the journey of Ecolink by training everyone. Today, just like everyone, I also allowed to embark on this training of trainer program, and I'm really looking forward. I'm also very impressed with all the geniuses who spoke before me. So I'm happy to be here. Looking forward. Thank you.
Thank you, Ronnie. You are in first batch or second batch? Remember?
I've been from first batch itself.
Okay.
Still continuing.
Okay. Okay. Good enough. Yes. Who else is there? Our yeah, Jyoti, please.
I am Jyoti Sharma Bharadwaj
Closing
from Himachal
remarks.
Pradesh,
And as of now, I am on the project team of Nasha Mukt Una Abhiyan, Himachal Pradesh. I'm closely associated with the Gunjan organization, and I work on different levels as a trainer, as a documentation officer. I have a book to my credit, Yellow Blossoms Towards Wellbeing, which is on this topic. I mean, I have written a few stories about real life experiences and few articles on how to stay on prevention, recovery, and treatment. As of now, I'm doing my VICE curriculum and I'm attending a refresher course with NDDTC AIMS about the treatment module. And that's it. I'm here for fun and learning. Thank you so much.
So thank you. Yes, Jyoti, I think with this we have finished our. Is there anybody who have
Yeah,
not
I
spoken?
think we have Chatura.
We have anybody?
I have to tell.
Chatura
Oh,
is there.
Chatura is there. Okay, Chatura. Yes, speak.
Okay, by profession, I'm a clinical psychologist. I have worked in mental ill rehabilitation center, and currently I'm working in de-addiction center for 6 years. I'm also a consultant in the private clinic. I've been also trained in suicide helpline prevention program. Recently, I've completed one more post-graduation in marital and family therapy. We also, from our place, de-addiction center, we do awareness programs in IT companies and colleges also. This specifically Ecolink training has helped in technicality and clarification whenever there is a question, whenever they don't understand certain concepts, whether it's a family or college students. So I should thank Ecolink for the intensive education what they've given on substance abuse specifically. So all in whole, to put in a nutshell, Ecolink has really helped in forwarding my experience. Thank you, sir.
Thank you, Chatura. Yes. Is there anybody else?
Yeah, we have Leshomo.
Leshomo. Where is Leshomo?
Yeah, he's here.
Oh, yes, Leshomo.
Yeah.
Good afternoon.
Good afternoon. Oh, Sabati. When
Yes.
you said Leshomo, I couldn't catch you.
I know,
Sabati.
Ah,
Okay. Yeah.
Good afternoon. Thank you very much for the opportunity. It's great being here again. UTC has helped me a great deal. I have been in the field of mental health for the past 13 years, 7 years in prison as a prison psychologist. And I've been working currently with schools, 3 primary schools, on issues of substance use disorders and alcohol as prevention measures, and also attending to those who are already using. So it's a privilege to be here, to be refreshed, to learn, and to have fun. Thank you very much.
Oh, thank you, Sabati. Nice to have you again back with us. Okay.
We have Tulita.
Tulita.
Luella, you want to say something?
No, Luella already said.
Yeah. I just wanted to say that Chatura actually trained me in my internship when I was doing my internship at Kripa Foundation. Chatura trained me in rehab, so she's a very good trainer.
Yeah.
Good.
And also, I forgot to say that I was in the first batch and the first student to write the online exam.
ICAP, yes, the first one who wrote and passed ICAP exam.
Congratulations.
Okay, great. Okay. Nobody
We
know?
have Tulita. Tulita is there? Tulita Vikarma Singh.
Hello.
Hello.
Yes,
Oh,
hi.
Tulita, Dr. Tulita. Okay. Yes. Our observer from US. Yeah.
Yes, thank you for letting me be an observer today. So it's been great participating in the UTC, and I was in the last batch up to 8. So I was, very enjoyed that a lot. So I'm in the more in the research side. So I'm more research and academic side of health, mental health, physical health, and behavioral health, and also looking at substance use from research, and less of practitioner, but I want to do more of practitioner things and also collaborate with practitioners in research, so practitioner research and applied research. So this is really interesting and great opportunity. So thank you, and looking forward to more future trainings like this.
Thank you, Dr. Tulita. Thanks a lot. You are free to continue also observing the whole thing, no problem. Okay.
Thank you.
What about
Shall
Raman?
we? Oh, Raman. Where is he?
I
The
saw his
singer.
name. I don't know whether he's there or...
He's supposed to be there. He's there. His name is there. Must be singing somewhere, I think.
Raman, are you
Raman?
there?
Oh, Raman will introduce himself later. No problem.
All right.
Okay. We a little bit running short of time.
Can we take a break for 5 minutes?
Can we take a break? Yeah, 5 minutes break. Come back, and I have 3 minutes for me. Then Aditi ma'am will take over. Okay.
Sure.
Okay. Thank you.
So the session is till 8 o'clock.
You need to come back, Shalini. Don't go away.
So
Yeah.
Okay, thank you.
6 to 8, 6 to 8. I will give a small introduction to the whole thing once you come back, and then.
Perfect. Thank you.
Okay. Yes, sorry to call you back 1 minute early. All are here. because we are all trainers. I think we are speaking little more than the first timers, no? So that's why a little bit out of time. Okay, so just give me a couple of minutes just
No
to give
problem,
you
Thomas. Take your time.
understanding about this program. Okay, can you see the slide, all of you?
Yes, sir. Yes, sir.
Yes, we can.
Okay. So as you know, like all of you have come into it with some tough selection process. You had even attended a, what is that, entrance test, you know, with 45 questions, tough questions, but somehow you have passed, all of you have passed. Those are done. ICAP, of course, we didn't insist you to do that, but somehow you have come to this with some processes like, no, so you are the right candidates. So believe in yourself. So I just want to give you the objectives of this program, because when we announced, there were a lot of doubts. People were asking, what is this TOT? Can we become global trainer, local trainer, and things like that? So I just want to clarify, you know, what this UTC, this training all about. So we have some of the organizational objectives and program objectives. The first part is our, you know, why we are doing as an institute, no, as Ecolink Institute, why we have thought about this is actually, you know, to develop a team of national trainers for conducting eco trainings. Like we have been doing curriculum 1 to 8, no, the full course from Ecolink. But here we want to train a group of people in each country actually, but we wanted to start with India, but we have given a few chances to a few internationals also, so that, you know, they get an idea and then later we can work out with them separately. Otherwise, it is to train national trainers to conduct eco training. Eco training means, to conduct other people, no, in your locality. So that is the idea. And then secondly, we wanted to promote short courses. It's not actually, we are not training you to do all curriculum 1 to 8. It is short courses, maybe curriculum 1 or maybe curriculum 1 and 2, or maybe according to what actually the people of your region requires, they want you to do. So Colombo plan with an MOU with us have given us freedom that you can either have full course like 1 to 8, or you can have a full curriculum like, no, with whatever modules in it, or you can even train one module, single module, and we can issue the certificate even for that also. So there are 3 chances like, no, so we want to make it as simple as possible, because every one of you should get chance to train, and you should be able to also get people easily into the program without much of trouble. That's why we will make those things. We will plan it at the last day, no, like how we will plan our training programs locally in different languages also, no, like it can be in Hindi or Bengali or Tamil or Kannada, any local language also. But if there are English speaking people in your locality would like to have a short course in English, fine, no problem. You have the freedom to do that. So that is our next organizational objective, to reach out to maximum addiction practitioners with some training, even if not the full training, at least something like, which is relevant for their practice in those locations. A lot of people couldn't join our program because of the English and things like that. So such people you will be able to target for reaching out with this program. So the third objective what we have is to assist Ecolink in integrating UTC education with academic courses. This is our new plan. This is our new project which we have already started initiating discussions with the universities and all. There is a positive response for that. So people who are already in certain courses like clinical psychology or MA in psychology or MSW or any health sciences like nursing or anything like. So those are the people who are going to work in the field in their own setup, but they cannot escape from addressing the problem of SUD, because they will have to encounter those problems. So we want to train people when they are students themselves, with basic information about SUD and how you can manage SUD. It can be the full course, it can be 1 to 4, 1 to 2, or whatever it is. Based on the requirements of the university, we want to try that. So you all people know who are doing this program will also be part and parcel of that program, so that you will also get chance to train students in the colleges like. So that is another third objectives which we have in mind when we are organizing this program. The fourth objective is actually it is something to do with our ARCO program. So we have an ambitious plan to develop a package of psychoeducation for family members, for general public, for people who are using substances, no matter what stage they are. It may be they just started, they have some curiosity to know what it is, how it affects our brain, or why we call it a science and things like that. There may be some students with that curiosity, but they started using it. So such people we want to include into the psychoeducation package, which will be a continuous program, every day like. So that is one area where all of you can get chances, as psychoeducators online. It's a program which we are developing through ARCO network. So these are our organizational objectives for organizing this program. And then we have some ToT program objectives, what we want to do through this particular program. From this ToT, what we expect from you. First is, of course, to prepare the participants with knowledge and skills in training, particularly keeping in mind their role to play as eco-trainers in their respective regions. Simple, to train you as eco-trainers. That is actually, one of the objectives of this particular training. Eco-trainer mean, like you are trained, you are training others. So it is like that. So second one is integrate teach back as an exercise to get an insight into one's own potential and capacities as a trainer, and improve the skills from constructive feedback and guidance from the resource team. So this is where to understand my potentials. Only by getting a public opportunity to present when others are there, you get an opportunity like this. Now, online, I'm telling online training also. So where the teach back will act as a tool for your training, better training you as a trainer. So that is our second objective. Third, to learn from each other. That's very important. So everybody may not have every qualities as a trainer, but all of you put together, you will be, having a lot of different qualities, way of addressing people, way of engaging people. So we need to learn from each other. So keep in mind, there is no competition in this. It is only each one is competing each other to learn from each other. So that is another very important objective we have, like you should be able to do that. And then fourth thing is to get a refresher and recap of both the curriculums by participating in the presentations by each member. See, we are not going to give you again a refreshing program about the curriculum. That you will get from the presentations from each one. So that is also one of the other expectation. So this is the last slide, where teach back as a training tool. The teach back is seen more as a training tool than as a performance tool. We are not here to evaluate your performance and grade you into 1, 2, 3, 4. That is not the purpose. So teach back will become the training tool. And this is not a competition, but a tool. Learn from one's own presentation and also learn from others' presentation. So everyone has to be there for all the sessions. I have finished my presentation, so I don't have anything to do. Don't think like that. You have more things to do after you finish your presentation. That is to learn from the other person and learn from the suggestions and feedbacks given by the trainers, and learn from interactions and things like that. And this is also an opportunity to refresh our memories, and you will get an insights into your own training skills and learn skills from others also. Okay. And then there is a rubric, which I think Thiru will explain. Aditi will explain to you later. But just since you are preparing, let me tell you the rubric is based on your knowledge of the subject matter topic and how you engage participants during your training program, and how you have supervision of the training environment, because this is a online platform, online environment. You need to see whether people are putting something in the chat box, someone is raising their hands and things like that. How you coordinate that kind of things we will be observing. And then time is very important, time management. After doing curriculum 1 to 8, I know everybody has so much to say, but we should also learn to say things within the time frame. Always plan your program within 13 minutes so that you will comfortably finish at 15th minute. So that is also very important. And then and the day manner, day manner means the way that you appear, the way you smile at them and you present yourself and things like that. So these are the things. So I end my introduction here. Say the rest of the things, and I leave it to Aditi ma'am. And I'm always there. You can ask any questions even after this in the WhatsApp group also. Absolutely no issue. Thank you so much. Over to Aditi.
Thank you, Thomas. So now that I've heard from Thomas that you've given 45 questions, I didn't know that, and answered and come here. I'm not going to test your knowledge, so don't worry about it. I'm very sure you all are very good in it and you all are great trainers. So once again, treat this as a kind of refresher for enhancing your own training skills. As very rightly, Dr. Thomas said that this is not a competition. So we are just going to enhance our own skills. All right, so let's start without any ado. So let me share my presentation.